Good afternoon, friends. Wish you all a very happy Sankranti. I am dr.Sairtha from Positive Homeopathy. Today I am here to discuss few points about infertility. Now, as you are all aware about infertility, if at all you talk about infertility, there are basically two types of infertility which generally people say. That is primary infertility and secondary infertility. Now, before that, what is infertility? Now, there is something known as sterility and infertility. Now, infertility is the failure of conception or getting pregnant after the first 2 years of married life, when two people are together without using any type of contraception. If at all they are not able to conceive in the natural way without any medicinal help or without any technological help, then you say that this is infertility. Now, infertility, as I said, is basically divided into two types, that is primary infertility and secondary infertility. Now, you see people saying that I have got one baby, but second conception becomes difficult for some people, some couples. And we also hear that there was no problem or there was no issue for the first conception. Or you also see people saying that I have got 2 or 3 abortions. Now, these are nothing but the primary, secondary infertility, where there is a history of positive pregnancy, but that couldn't continue because of n number of reasons. There could be spontaneous miscarriage or a medically terminated pregnancy, or it could be that their uterus is not in a position to continue it for a longer time, unlike any natural conception where it can carry its conceptus for almost 9 months completely. So this is not a secondary infertility. Nowadays even secondary infertility has become very common. Now, primary infertility is when a couple who are being in a married relationship continuously for a period of say 2 years without using any kind of contraceptive precautions, if they are together and if they fail to conceive, because what happens is generally the couple gets conceived in the first year of their wedding, after their marriage, then the chances are nearly almost 50 to 75% that they conceive. And in the second year, the chances of conception will become almost 80 to 90%. So if at all a couple is failing to conceive in this first 2 years, then that could be a point where you need to be intervening with the medical treatment, or at least opinion of a proper physician or person who can help you out with this quite. Now, as you know that infertility, if you observe nowadays, it's one among the many problems which we hear, like obesity, PCOD, thyroid, diabetes, hypertension. So all these lifestyle disorders which we see nowadays are somewhere or indirectly or directly are attributed even to the infertility problem. Now, as a woman, now there is something known as a age priority, or the criteria of age, where the egg will be in an active stage for a certain period of their life, wherein the active period starts between 20 to 30 years of their age. Now, once the girl or a lady, a girl who attains her menarche, generally tend to have every month a ovulation process, and then the ovum is released. If at all there is a chance of fertilization, then that will continue as pregnancy, but if at all it fails to conceive, then it continues as your regular menstrual cycle. Now, during this age, or during the first few years of puberty, in case of a woman, a girl, we see that this generally happens between the age of 12 to 16 years. So you will see that the girl attains her menarche, and you see so many changes happening mentally, physically in her body, and you end up have to have a proper handling. Especially the first phase of contact would be the mother or the immediate family members, who should educate the girl about how to maintain herself, how to deal with the new changes happening in the body. So at that point, once this hormones get stabilized, because there is a transition period, almost I'll say, you can see that once the period starts at 12 years, the fluctuations of the hormones take time to stabilize. It will be almost till the age of 16 to 18 years, they have this kind of irregular periods, over bleeding, no bleeding, less bleeding. See, all these are natural things, so nothing to get panicky about this kind of condition, especially in that age, because as a parent, as an elder, if you are able to understand the condition and if you are going to counsel your child, that will be a very good approach first of all. In case if at all that becomes little difficult to handle, then always we are there here to help you out, like how you can cope up with this kind of thing. Not only the physical body, even you see that personality development, of personality changes, the mentality of a person will also change because of these hormonal influence. Even if it is a male, during this now, you see the young boys who are in their teens are very difficult to get convinced, or they are very difficult to understand, and there's a type of pressure created between the parents and the child because of these hormonal transition which happen. So as a parent or as a close relative person, you need to be very careful to handle them in a systematic, as they are going through a very delicate stage of their life. Once they complete their teens and they come into their proper youth, now you see various kinds of changes, especially physically, and then coming to even mentally. Now once they get into their academics, they are very much busy, they are a stressful life because they have to concentrate on their academics, and once they are through with the academics, they have to cope up with the physical requirements and physical changes happening in the body, both in girls and also boys. And then the next part of the life is the settlement, the career settlement and all. In case of men, it becomes a mandatory thing before they get into proper life or get into a married life. They have to settle themselves in a proper sphere of thing. And then even for a woman, nowadays as you see that women are nowhere less to prove their capabilities in all fields. They also are very much keen about their settlement or their academics, or because see, whenever you talk about a female, once she gets into a married life, when she gets married to a different family, now she has to face so many challenges, like adjusting to the new family, because she's leaving behind everybody and coming to a new system. You have to add this kind of adaptance and clementines, and then you have to get acquainted with the new things, because definitely as she's been brought up in such a way, and when you come to a new family, definitely there are so many things. So this is the point where generally girls are getting affected, and because of which there are so many hormonal problems actually surfacing, and then having various kinds of issues like PCOD or thyroid. You can see in young girls, especially we mostly see girls coming to us or young couples coming to us saying that the failure of this conception or the infertility program, either they end up having PCOD or either thyroid problems. And in case of men, we also see this diabetes, thyroid and obesity, varicocele. So many issues which are actually intervening with their medical aspects, which intervene again with their fertility rates or the conception process. So now infertility is basically because of either the causes of, in case of a woman, that is a wife, or the second thing is problems in the husband, and sometimes there could be a combination of both. So 20% to 30% will be male reasons, 20 to 30% will be again female reasons, and there will be a chances of combination of both. And there are some kind of infertile cases where you see that the wife, husband, and both together also have no issues, but still they fail to conceive. That is known as unexplained infertility. See, that is again a very major cause, because if you talk about other systems or the modern systems, they see the diagnosis and help you out with the problems like how to treat. But in case of homeopathy, now as a person who is into positive homeopathy, we have seen so many patients or couples coming to us after a long course of their trial and error of all kinds of advanced technology, all types of treatments, interventions medically and surgically. They come to us saying that they have not conceived, though everything in front of them is saying that they have no issues at all, physically or mentally. Now, at this point, we have a very positive approach, and we especially take pride that we are able to help such kind of couples, because there is something beyond the diagnostics. Because a person who is fine, everything is going fine, but still they are not able to conceive, then there is something which we can help, especially to these people who have this kind of unexplained infertility. Now, we are going to have something known as individualization process, or say ailments from, because every individual will have their own kind of personality, mentally, physically, and their way of reaction to various situations in a given circumstance. Now, 10 people in a family facing through a same situation will not react in the same way, because that is where, as an individual, you differ. So, according to these kind of individualistic traits, out with the treatment. So, infertility. But the thing is, now again, when I come to the top point that how far I can help you out with homeopathy, if at all somebody is coming with this kind of unexplained infertility. Now, there are certain criteria, like a person who is having a continuous married life of say some kind, say 5 to 7 years, and have got nothing to do with the medical issues, and they have got various kinds of complaints, and they have already been to various kinds of systems like advanced technology also. If they are not able to conceive, definitely then we are going to consider something like age factor, which is very, very important, because whatever is the system, there is something known as nature and its kind of now, whenever I talk about nature or natural things, there is a bit age factor which is very, very important for any individual to have a proper pregnancy or a conception process in a given particular time. Now, if at all you come at age of 35 plus, they're saying that I have got so many things done, nothing has worked out, and then you come to us saying, expecting results, then that becomes a difficult point, because now, as I can give you treatment, but that is where I have to caution the person that this is the factor. Now, person who is being actively involved in the married life and then no issues, but the quality of the egg or the quality of the sperm can differ with the age. Now, a person who is crossing 35, the quality of the ovum or the egg will get deteriorated, and once you cross 37, the chances of the fertilization process will become very negligible, that when compared to early 20s. Now, even in case of men also, now basically there is no such menopausal stage, like in case we have the female, there is something known as andropause, wherein they do have the effect of these kind of problems with the age for the fertility. So in case, if at all you're coming to us, now the factors which are there according to nature has to, again, cannot be reversed, but still we'll try to educate the person, set their mindset, so that accordingly we can help them out. And if at all you talk about infertility in case of female, now there are various reasons, starting from a simple thing, that is lifestyle. Now, in case of lifestyle, today's modern lifestyle, you can see the sedentary lifestyle. Now, I will not blame anybody, because it has become a part and parcel of our life that we are acquainted with so much of advanced technology that we hardly have any kind of physical activity unless we wanted to go and do some kind of exercise or workout. Because that's when you are earning more and when you have too much of mental stress, who is working continuously a day long, and then you end up coming home and then you hardly have anything to do practically or physically at the domestic level, then you tend to have a support, whether it is in the form of a cook or a maid or a helper, who is going to help you out, because you can't do everything, you can't take too much of mental pressure. So at this point of time, what is happening is the sedentary lifestyle, which is actually making them to increase in their BMI. Now, BMI is nothing but the ratio, basal this body mass index, which is nothing but a ratio between your height and weight. Now, there is something known as stages like pre-obese, obese, and overweight, and then moderate obesity, severe obesity, and all. Now, you have to maintain your weight and height in such a way that you come into a healthy frame, that is below 25 at any point of time. I know it is difficult for you to have a proper physical activity when compared to your oldies or when you compare to your elders, but at least you try to do a workout or something to maintain the kind of ratio. So obesity is one reason. Now obesity, how does it involve in the infertility? Whenever you have too much of abdominal fat around your waistline, now what happens, there is something known as progesterone and estrogen hormone, androgen and testosterone hormones which are there in any individual. Now in female, progesterone and estrogen hormones have their own kind of influence in the periodic that is menstrual cycle. Now too much of fat accumulation will stimulate the progesterone hormone, which will make you not to get your regular periods, which will actually disturb your regularity of your menstrual cycles. So first thing is this kind of lifestyle or whatever, obesity, whatever saying, and especially the central obesity around your waistline, you need to take care to come down with your inches. Even though if at all somebody who is not at all overweight but still end up having too much of fat around his tongue, so that has to be taken care. And at the same time, too much of high calorie value food or the junk food, the ready-made kind of food or with the kind of preservatives. I do understand, because again the time is a factor where if at all you have to do everything in a proper way, you need to depend upon certain kinds of shortcuts. But at the same time, make sure that you are giving little enough healthy diet for you, so that you will not end up going around for the problem which you have created knowingly or unknowingly in your past. Because we see people during their peak years of say young years, wherein they have to get into a married life, going for a conception and all, they first say that let me just complete my settlement, my career, my progress, my prospects, and then especially in case of women, and after their 30s they end up coming with the problems like infertility. Now what I suggest you is, everything is important, but try to respect the nature and try to complete your married life, especially before 30 years of age, so that you have lifelong time to work. Now this is how I suggest you to plan out your pregnancy. Now in case of men, too much of smoking, too much of exposure to the environmental chemicals, in case if at all they are working in any such kind of places wherein the sperm quality or the maintenance of the temperature or something like that is difficult, then you have to take little precautions accordingly with the help of the guidance of a person who will help you out. Now, let me just look into the comments once. So in case of men, now you have seen this as smoking and the type of lifestyle what they undergo, especially even in case of the central obesity or the obesity is something which is very important. And second thing is smoking, alcohol, and the way they dress, the type of clothing nowadays which you can see, that is also very important to maintain the temperature of the sperm in order to have a proper fertility. So and this most important thing is there are certain reasons like hormonal problems which are like PCOD. Now we have even before also discussed about these kind of problems even before. Dr. Deepika was also explaining about how hormonal problems interfere with the infertility thing. Most of the people come up with PCOD problem. Now what is PCOD? PCOD is nothing but a condition wherein now as a fetus, when the fetus is, a female fetus is developing in the womb of a mother, there is a development of ovaries, and ovaries which are there, right and left ovaries which are 2 in number, will have enough amount of eggs present in them as reserve. And during the age of menarche, after the age of menarche, when the hormones actually get stimulated and they become active, every month one, that is generally the cycle you can consider as even if it is 21 days to 35 days, if you are able to get the period, then that is a normal period. Because people are even stressed out that every month I am not getting my period. In 12 months I should get 12 periods. That is not a hard and fast rule. Even if you are getting 9 periods in your 12 months, that is fine. That is a natural thing. Now every month, one egg of your, from one side of your ovary gets stimulated, it gets completely formed, and then the follicle gets matured, and then if at all it coming, whenever it is coming across with the sperm, it gets fertilized, and then it continues as the conspectus. But if at all it is failing to failing to fertilize, then the next would be that it comes as a regular period. Now, this is the natural process. Now, if at all you are talking about polycystic ovarian disease, now what happens is there is something known as water cystic formation around the egg which is being released. Now, though the egg is released, but it is not able to come up with a natural path and not able to get fully fledged form to help you out for the conception, and then it becomes very difficult. If at all it is getting stuck in the ovary itself and it's forming into a cyst, there is a chance of irregular periods, missing of periods, or else if at all you say by force, if at all with your trying to stimulate your periods by using some kind of hormonal intervention, then you end up having the withdrawal symptoms. So this is something known as PCOD problem, wherein the ovum is getting stagnated or accumulated in the ovaries, forming into a cystic formation which is known as polycystic ovarian disease or a syndrome. Now when I talk about syndrome, the PCOD is not just something which is related only with menses, that is menstrual irregularities. PCOD can lead to various other complications, not only during your active period or till the stage of your menopause, but after your menopause also you have this risk factors of getting into type 2 diabetes, that is insulin resistance diabetes, and second thing is you also have end up having calcium deficiencies, wherein you end up having this kind of osteoporosis and osteopenia. These are the conditions wherein you are more prone to get brittle bones, or the density of the bones come down, and then you have this hypercholesteremia or dyslipidemia, which is nothing but the disturbance in your cholesterol levels, which will actually give rise to various other complications. And you also end up having increased bone weight, your body weight, which will actually disturb your general activities or lifestyle. So these are not just stimulated to the menstrual cycle itself, because we get couples saying that if at all we are able to conceive properly, say for a year, able to conceive it in the next 1 year and have our 1 or 2 child, then if we complete this process of completion of our family, then people are hardly bothered about whether they get periods, whether they get irregular periods, whether until unless it becomes very emergency, like having too much of bleeding or ending up having so much of problems. Until that point of time, they are not very much bothered. But I want to educate as a person. Now, if at all you have PCOD, please be careful that not only menstrual disturbances, it can end up having various kind of complications, especially as I have said, diabetes or calcium deficiency. Now, in case of men, if at all you talk about infertility, the first thing is lifestyle, as I told you, and smoking, their obesity, their sedentary lifestyle, and the kind of dressing which also I have. And there's something known as varicocele, which also interferes with the quality of the sperm. And diabetes is also one of the most important cause for male infertility, where you see that there is an impotency which is observed. Now diabetes, what happens is during diabetes there is enough amount of blood glucose which is there in the body, but there is a resistance or insufficiency of insulin which is created by the system, which will not allow the end organs to take up that glucose and do that particular kind of activity. Hence you can see in case of men there is a loss of libido or impotency. There is a erectile dysfunction, which will actually lead to the infertility condition. And you can also see varicocele, as I said, that is one of the most common problem. And thyroid is also one important thing which actually leads to infertility. Besides all these things, even in thyroid, in case of female also will be affected. Now, besides all these things, now we have some inborn or by default genetic traits, something like Turner syndrome, or Klinefelter syndrome, or Down syndrome, wherein the system or the chromosomal errors are there, which are basically reason for infertility, which becomes impossible for us to treat, because that is something, a genetic trait which has been carried out. And there are certain things like after infections like pelvic inflammatory disease or STDs, wherein you have this kind of tubercular infections where tubal blocks are one reason. And there are certain things which are causing a disturbance in the uterus, like fibroids or cystic developments, or polyps like things which will not support the fetus to carry the uterus to carry the fetus for a longer period. So because of which you see there will be a simultaneous abortions or say miscarriages. So in this case, again we have to treat the underlying cause. And there are certain kinds of problems, like in case of men, you see the sperm quality matters because of various things like their lifestyle or their profession, so that has to be taken care. Now here are a few comments, let me just go through it. How long will I take to diagnose a problem if I consult homeopathy? Now if at all you're talking about the problem, now as I said that in the first year of, say irrespective of your married life, if at all you're trying to conceive, for a period of 2 years continuously without any contraceptive precautions, then you should be in a position to conceive. At least the 90% of chances should be there. If that fails, then we are here to help you out for the diagnosis, and the diagnosis will hardly take any time because today's technology is so advanced that today you go in for a diagnostic test, immediately you are going to view get your reports in a very short span. Once we have our reports, like what could be the reason, whether it is wife, husband or together or any other thing, once we come to a conclusion with what is the reason, accordingly we can start with the treatment depending upon the severity. As Ananya was asking, if I consult a homeopathy, how can I see? The time required for you to get diagnosis is same when compared to homeopathy or allopathy. But the thing is, how you treat, how your body responds is again a matter, like how we plan. So that differs. Now Sheikh is asking is infertility cured by, is it possible in homeopathy? Yes, definitely homeopathy will help you out to treat these infertile problems, because as I said, there is something beyond the physical body or beyond the diagnosis that is known as individualistic traits, where in spite of doing everything, we see people coming that we have 3-4 cycles of IUI, 3-4 cycles of IVF, wherein everything goes fine when it is outside the body, but once it enters into the body is not able to continue. So we are here to help you out, at least to stand for those kinds of treatments. If you get some kind of side effects, yes, we are here. If at all you want some kind of support to the same treatments, then also homeopathy can help you. Mr. Jagu is asking, I am arthritis patient and many more internal problems like cramps. Now arthritis is one important or one common problem, like any individual after the age of 50 years ends having it, because every day wear and tear, the bones get damaged because of the quality and the quantity of the lubrication which is being used, the type of wear and tear, and then the lifestyle. And if at all you have this kind of calcium deficiency or nutritional deficiencies, everything will add up into your arthritis. So I cannot reverse the age factor is there. Now if at all it is arthritis, now we need to know whether it is age-related arthritis, whether it is autoimmune disorder like rheumatoid arthritis, because you couldn't mention your name and all, because there are so many things which matter. There is something known as psoriatic arthritis, there is known as infective arthritis. So if you talk about arthritis, there are nearly 100 types of arthritis. Now if at all you are approaching us, we'll help you to diagnose what is the arthritis, how it can be taken care, and what are the other internal problems like cramps. Cramps could be, simple reason for cramps is the kind of weather nowadays we feel, that is too much of low temperature. So you end up having this kind of cramps. And if at all you have calcium deficiency, if there is some kind of sodium calcium metabolism difficult, then also you end up having cramps. So there are various reasons why you get cramps. So before I wind up about the infertility thing, now I want you to put in your queries, even if at all I am not able to answer it right away. If you get any kind of if you have any kind of questions, you can put in so that we can personally get back to you. And at the same time, as I said, knowing about the problem or getting awareness with the help of media or the same networks, nowadays you have so much of exposure to any kind of problem. Now as soon as you see infertility, now people, as soon as they come across a word like infertility, when they have a doubt that maybe I have, then they start browsing and searching and they get too much of knowledge. They come to us with so many queries and so many questions. I would request them not to get into any kind of conclusion, because a professional is a professional, and when you read out as a layman, you get much of confusion and you. So if you approach a proper channel, come down, meet, clarify, so that you will be free from your mental tensions. Otherwise what happens is you mess up. Then you end up into getting into actual problem, though you may not have. So let me just wind up the thing, and I wish you all a very happy Sankranti. And in case if you at all you want to reach us anytime, anywhere, we have a toll-free number, customer, and however we are live every weekend. So have a nice weekend. Thank you.